You're not able to usually need like an element, so like it's key out, it's unlocked. Don't work.
Yeah, he was able to.
Really?
Oh, he was,
Yeah,
yeah.
so he was impressed with that.
You start with a little.
I know, it was there.
Concentrated. And then.
Probably not. It has the same outdoor.
Well, I used to bring like a wrist set.
They just spray enough of it.
So they can go and to your neighbors.
And then come to find out, the neighbor puts these.
Yes, I didn't want me up.
So he sort of contains in the holes.
There you go. So they were coming down to your house.
Right, so he puts those in, and then Skiers does that, and Skiers them back my way.
Oh, gosh. They don't live very long anyway.
So do they want water or chips?
When do you leave?
We went all out for water and chips.
Well, that would do it.
So we get the Doritos.
Oh, we'll have a good time. I mean, they're the best.
600 gas.
Yeah.
I saw them.
No.
Looks like I'm through the flame.
So you need to stay awake.
Do you?
I won't leave the car, I won't anymore, I'm not. Oh, I like, I know you do, you know, but I'm not in the
That
good
is-
trips and.
Yeah, well, that's up and down, like, to me. Especially with the deadline, but I don't know.
I know, if I could take like months and months off, I'd just literally do week 16. I do the entire. Yeah. I just love it. I drive across country. Not me. I would.
Well, it's been
Hello.
Morning.
here.
Yeah.
Yeah.
This past Monday.
For London?
Couple hours.
That's right.
We didn't leave there until almost 3 o'clock, 4 o'clock.
Don't get caught on
Yes.
those cross-border ski traps, right? Drops down to 30.
Oh, geez.
That's it.
What do they just do a lot of testing and blocking?
I know, but I'm looking for a ticket.
They're-
Well, it is kind of early yet.
Going out, you know,
Well,
once they
yeah,
start
usually,
to
well,
try
no, 3 months before is usually, yeah, yeah.
Blood working testing.
I'm an homeless chick.
First.
Yeah.
The amount.
Exactly.
Where are you trying to find out?
And like pharmacy was back.
Okay.
Doctor was late.
I'm not going to bother. I wouldn't either.
Well, that's why.
Good news is that you know that's your
In discussions
plan
with
B,
government
just keep checking.
about social workers, and I want to have more conversations with
That's what I was thinking.
I just want to have
4 days.
we try to sign up with them. Well, since America, they're providers to the companies that take that CPS
Yeah.
hours.
Okay, so I'll be out in the
Well,
middle of
since
Yeah.
till March.
company out of
Yep, so then I'll get another
It's
call.
kinda like
Just gonna need a few more days.
So when they don't, information doesn't get picked up, so I told them, they're waiting out in front of the house.
Okay.
So,
Right.
not only, you know,
Don't tell Stephanie. I'll bring my laptop. And you're gonna get that dream of yours.
but now, all the people at Dartmouth that had a SWAT team, all that is
I don't
now,
know. I
something,
can't.
they are real people.
I can't, I know what happens, but that's almost criminal.
Well, that's why.
That's true.
Because
I insist upon it.
It's not happening.
I'll be bombing you in the back.
You can even come down for a week if you like.
Wow, really?
It's all coming together.
What is he? 2.5. That's it.
This is what,
This is
story
right.
is.
And you can
Right? I can rent the office. Oh, sure. Put that in.
Everybody's organized to take care of
That
them.
in your bedroom? Yeah. The living room.
something that takes place. That subject is business. So, that just screws up. Not, let's say, Haley's always up with us. And then all of a sudden, that day, because they don't come until the person doesn't show up.
Say half of the non-title match,
You just call somebody.
so it's like,
Hey, good.
so whatever,
Right.
just
Plus,
half of whatever come up with based on
after chemo,
Yep.
yeah, she finished.
I did. Yeah, thanks.
so not like at the end, so
Yeah.
you can run your operation.
I use it all around town.
And the difference between traditional
Yes.
and that was basically, they've been able to sustain service. So the additional IJA, the additional, it's like that operating difference.
Yeah, I think we did soon, but then,
Obviously, we see it.
increase the
It's been
Yeah.
Oh,
long term, I just think that's
So,
that level, which would be
somebody needs to arrange their.
Yeah.
And ultimately,
I was talking about you this morning because I said
that's still right,
Yeah.
So it's like she's,
Oh,
we're just asking for middle,
Yes.
middle.
Get a ride?
It's
Yes.
us.
Yeah.
she doesn't get transportation.
No morning. She has her.
Okay.
Long shot.
Well,
It was.
I was gonna say, how many years ago?
Yeah.
They scored something, but it was.
Times have changed.
She had she had to force the situation and. Not much, just kind of.
Yeah. Yeah, 'cause he was up there.
Yeah.
Yeah, still never see that.
I'm seeing them for a while, I do my personal.
But your personal.
Yeah.
Yeah.
They don't big enough, it needs its own.
And when I asked them about it, and I said, can you give me a printout, because I had no idea what I was paying, what I was being billed for, because they didn't have it broken down, when the date was and anything, it was just overdue. I said, can you give me a breakdown of what he's charging for? He sent me 5 printout. What a waste of money.
Yes.
All my stuff, and I couldn't even get on the portal. Because they've changed systems.
June was going down piano. She went back to Virginia.
I know, even I.
Hey, Dan. See you for a sec.
Like, so just to be eligible, you to have,
I know. Yes. Not yours.
Yes. So in order to.
Well, I'm down in Concord is pretty much
Yeah.
late.
Yeah, I switched most of mine. Well, so come.
Like for long distance.
All the children, I didn't never get, never ever could.
It's always a co-pay.
Yeah, but I have a second, I
Yeah.
have a second.
Yeah. Exactly. And then all of a sudden you're billed $300. It's where,
Yeah.
oh, why did you?
To me, it's still
And they've been to a lot of people who have been
Good morning. So, good morning. And welcome to our meeting to basically do a kickoff for Plymouth Transportation. I think my advertisement was a little bit maybe premature, but at least it shows our desire that Plymouth is getting a bus. And Plymouth is going to get a bus, depending upon when actually that is going to work out with both Tri-County Cap and DOT and our statewide and local mobility managers. But it's definitely on the pathway. And I just want to basically welcome all of you to this kickoff. And it's not exactly a kickoff. It's been kicked off before. And Patsy Kendall and Doug Grant are in the audience. Patsy was the developer of Transport Central, which was an NEMT, non-emergency medical transportation business that transported anyone over 60 or disabled. And we only work with volunteer drivers and their vehicles. So Patsy kicked it off with a desire also to provide transportation for the town of Plymouth and then beyond at some point. And she worked very hard on, with the university, with the town, and it didn't quite get there. And I think we're, as close as we have been in the past, and hopefully we'll be able to, put it in gear and finish it off. There goes Doug. So I want to thank Patsy first of all for, being there when it counted as far as like providing transportation to needy people. And that's the gist of where we're going as far as providing transportation for not just elderly, but anyone that needs transportation for employment, for entertainment, for health purposes. But it's something that's been lacking in the town of Plymouth, and we see a statewide movement to be able to make sure that every community has that access. So I want to let our mobility managers, we have a statewide mobility manager, Terry Palmer, and our Regional 1 mobility manager, Nicole. And, I'll let them take it from here, and we'll have a discussion afterwards. Thank you.
Morning, everyone. So Bill and I have been talking about this for quite a few months now, and there is a feasibility study out there that was done back in 2010. And looking at that feasibility study, I kind of chuckled to myself because it's the same feasibility study that is pretty much done in a lot of areas in the state. I was actually a transit director in a small agency over in Claremont, New Hampshire, and we have the same type of feasibility study. And it was just interesting to see, how everything was almost cookie cutter. But at the same time, there was some real needs here in Plymouth, and you're very unique because you do have Plymouth State University, and there was already some coordination being done with the university as far as transportation, because of course the students wanted to get to, at that time it was Walmart and Hannaford's, now you have Market Basket and so on and so forth. And they wanted to get downtown. Now, in talking with folks, the students are wanting that quick on-demand system. So as we get into kind of the presentation, I want you guys to ask questions, give feedback. Nicole is going to be kind enough to take some notes. And we're just going to touch on some things, and we definitely want to open discussion because we want to hear what you have to say, especially moving forward with the plans for, as Bill loves to say, bringing a bus to Plymouth. So we do have Fred Butler from New Hampshire DOT in the room. He's going to kind of talk to all of you about next steps, at the DOT perspective. And then we also have Brenda and Jean from Tri-County Transit, which their transit agency is within Tri-County Community Action Program. So one of the ideas that we're thinking about is Tri-County Transit putting public transportation in Plymouth, and then they would be doing all the dispatching, maintenance, so on and so forth. So we'll talk about all that when we move forward with the slides. So what services are offered now? This came right from the feasibility study and then also some work that Nicole did. So Future Insight, they provide transportation for residents, with sight disabilities. They're a statewide program. Granite State Independent Living does some transportation. Of course, Transport Central does your volunteer driver program and your on-demand service in the area. Then you have Grafton County Senior Citizens Council, and then you have Plymouth State University, which, from what I understand, is providing some public transportation along with student transportation. And if I'm saying anything wrong, please correct me, because that's just the information that we have. So the feasibility study kind of gave us, now remember this was from 2010, okay? And then, some of these things we may need to fix because it's been a long time since this feasibility study has been done. So some of the major employers, of course, the ski areas, we know that they're seasonal, and in 2010, they were employing anywhere from 650 to 800 employees. And I'm sure that's gone up, especially with Loon Mountain. I do believe, did Tenny Mountain close for a little bit? They're reopening, so that, hopefully they'll have some increased employee count there too. Of course,
2018 with the IIJA that was passed, the bipartisan infrastructure law. The federal side is much more certain than it was 5 years ago because of that. The federal apportionments went up. So the projections are that we will have the wiggle room for such an expansion as this and probably some others. That $250,000, that is out the window 5 years later, as we all know. Probably want to add, I'll say 40% to that right off the top. Drivers are always a limiting factor, and buses, right? I've been working on placing the bus order for over a year now, as Tri-County Captain can tell you. And the order is not solidified yet. It has to go through our governor and council process. I know we're going on a bit of a tangent now, but that is something we've been working on for over a year. It's not slated for approval until November or so. And then based on the nationwide vehicle shortage, they're looking at a year delivery at this point for, if not more, right? That's what they guess, and for something that used to take approximately 6 months. So everything is costing more and taking more time these days. But the fact it was in the statewide assessment is a very good thing. And even though it's a priority tier 3, Laconia has already been funded. It hasn't started yet. They're hoping to do that again with drivers. They just need some drivers to hire. That should be going in the next few months, and I don't know if the other ones are in the works. So I think your timing is very good for this to make it happen from that regard.
So I thought it was very important for community to know that even though this is tier 3, it is part of the plan, and so it would be, like Fred said, it's not out of the realm of possibility to get Plymouth transportation bumped up to 2 or 1. We do know that the Laconia transportation, we're hoping, is going to start in October, but like Fred mentioned, Concord Area Transit is attempting to hire a couple more drivers for that. So fingers crossed it does start in October. So this is why we're all here. Where do we go from here? So we know that the residents want reliable and quick transportation here in Plymouth. We heard at a couple of meetings that, folks would use public transportation, but it takes too long to get from point A to point B. So how do we fix that? Students would like faster on-demand transportation. Some students come here from living in a city and they want to be able to call an Uber and run to the grocery store and come right back. They don't want to wait for the bus to come back through. Older adults would like a better service provided for them. Same thing, if older adults want to go to the senior center, maybe they live on the outskirts of town, they don't have transportation to come to the senior center. We know that social isolation and food insecurities are top priorities here in the state of New Hampshire, so how do we get our older adults to these resources? And residents would like better work opportunities. We're coming into the winter season. Waterville Valley, Loon Mountain, Tenny Mountain is going to be reopening. How do we get these folks back and forth to, the opportunities that they want to seek out? And how do we get to the next steps? That's why we're here today, to kind of talk about next steps, okay? And this is my information. And so mobility management, we have our hands in a little bit of everything. We advocate for our transit agencies and providers. We also work very closely with the residents. Nicole will be the one that gets the phone calls from the person who lives right outside Plymouth town lines, I guess, and says, I want to go to the senior center, I'd like to have a hot meal, I'd like to be, socially involved. And then we have to try and figure out, working with Transport Central and the transportation options that you do have, how to get them to where they need to go. So that's how we're involved. And then, of course, we work very closely with Bill and New Hampshire DOT and Tri-County Transit to kind of make it all happen, bring it all together. So we work very closely with the partners and stakeholders as well. So if you have any questions, comments, or concerns, please feel free to reach out to myself, Bill, Nicole, and we'll have business cards and so on and so forth available. But now what we want to do is, with Fred's help and possibly Brenda's, just kind of talk to you about what we've been thinking, and kind of like our roles as far as going forward. You know, unfortunately, we can't snap a finger and say, well, Tri-County Transit's just gonna hire a couple drivers and we'll put a bus down here and we'll start transit. Unfortunately, it's not that easy. So, of course, they're giggling back there. They're like, oh yeah, sure, we can make it happen.
All right,
So-
right, guy.
Janine's a miracle worker. So I don't know if you guys want to join me up here, or I don't know what's easiest for Dan. And if you guys have any questions, please ask us. That's how we're gonna, that's how we'll be able to move forward.
Yes, you can jump too.
Suddenly she's shy and has no voice.
Suddenly.
Yeah, I know, right?
That's every meeting.
My name is Brenda Gagne. I'm the Chief Programs Officer for Tri-County CAP. I'm also a lifelong transit person. I started my career as an operations manager for Tri-County Transit, directorship, and then I went to a department head over transit, and now I just talk to Janine every day. Janine and I were actually just sitting there discussing what would be the best system for Plymouth. I will tell you, I had a daughter go to this college, and as a freshman, she wasn't allowed to bring her vehicle with her, which was devastating, because, oh my God, Mom, I have to walk. And I said, no, wait a minute, I think you guys have a bus system there. And she discovered what public transit was, taking the bus to the grocery store. When this came up, and we've been talking about Plymouth for 5-6 years, I think. I mean, I know I was working with Patsy, yes, long time. And I know it seems like it's forever, but it's really close now.
Yep.
And our job is to figure out what's gonna be the best and most efficient and productive system to put in Plymouth. And as Fred said, a lot of it depends on getting funding for the system, getting buses, and you've heard how that's going. And we don't take it personally, Fred, we know it's not your fault, but we are waiting on buses. And then drivers and getting them trained. We are fortunate enough that Janine is also a certified trainer for the state in all the training that the drivers need as well. I see a couple of, do you want me to share with the group? Yeah, share with me. Okay.
Don't keep it secret.
Yeah. I see a couple of different things and possibilities. First is what is called a door-to-door system. It's a demand response. People call, they schedule their trips, the bus picks them up at the door of wherever they live and drops them off at the door wherever they gotta go. I should mention that all our vehicles are all wheelchair accessible. We have lifts in every single one of our vehicles. So anybody with some mobility issues shouldn't feel that they're not able to ride transit, because it is available to them with passenger assistance by the drivers, wheelchair securements, any kind of mobility aid. We can pretty much take on our buses. But I see a door-to-door system as a good possibility. Terry is right, nobody wants to be on the bus and do a fixed route because of the length of time it takes to get from point A to point B. We actually operate a couple of what we call flex routes. One in the Berlin-Gorham area, and then one that operates between Lancaster, Whitefield, and Littleton. And they are convenient for going shopping, to get to work, but yeah, if you just want a quick trip to go pick up dinner, a flex route's not always the best choice. Although I will say flex routes, people enjoy them because it gets them out. They can socialize while they're on the bus, they can go to Walmart, spend an hour poking around, shopping, doing whatever, and then get back on and take the ride home. The reason we call ours flex route is because we deviate up to a quarter of a mile to pick up passengers who otherwise are unable to get to a stop, an assigned stop. We operate the flex routes, but we also provide door-to-door transportation as well. If anybody has ever been up to Pittsburgh, they know that it's a long ride to get to the nearest grocery store, which is in Colebrook. But that service is very productive for the people there. A flex route would not be. I know a little bit about the layout of Plymouth, just from running back and forth for an entire year to bring my daughter home on weekends. I can see a door-to-door system working very well. Janine, something to add?
I think you guys are looking at, with the population here, maybe 2
Two door-to-door buses, yeah,
so they could be going.
yeah.
And are those smaller size buses or not a full size?
I'm sorry, I should have mentioned that. Yeah, we operate 8 passenger buses.
Okay.
We have 2 styles. We have what's called a cutaway, which means the cab kind of comes over the top part of the windshield. And those, again, can take 2 wheelchairs and passengers. We also operate 16 passenger buses on our flex routes. Same thing, it looks kind of a cutaway design. We recently started getting Ford Transits, right?
Well, yes.
Yes, right, Ford Transits, that's what they're called. Okay, I'm thinking it's the Mercedes, and we don't have Mercedes. But they're more like the panel type side van with sliding doors and or the ramp on the side or in the back of the bus. Right now, our passengers really seem to like the buses the best. And, I mean, like, we quite often will have a wheelchair client and 4 of the passengers on the bus at the same time. Pretty much all going in the same direction. We coordinate our trips so that we're not wasting time, energy, and money by driving back and forth like this all day. So we have a certain way we like to schedule. And it also minimizes the time that people have to be on the bus, you know, especially if they're going to an appointment. If it's medical or hair appointment, nail appointment, getting to work. We usually work with our passengers to schedule enough drive time, specifically in the winter. And everybody's been through winter up here, right? They know how that is. During really, really bad storms, we have closed our service before, just because it's too much of a danger to the driver and the passengers. But we operate on a system where we never leave anybody out. We wait until we get the last people back before we shut down our system. And that's a level of trust we're fortunate to have with our passengers. They know we're coming back, we're not gonna leave them. We have had one particular instance where somebody went in their 4-wheel drive pickup truck to go get the passenger back home just because the roads went from snow to ice to sleet to snow to ice, ice, ice. And we didn't want the bus out there, so we brought them back home from the grocery store in a 4-wheel drive truck. But that's how we operate our system. We don't leave anybody out there. But you see at least 2. Yeah, that was kind of my thought too. They are very efficient to operate. I mean, people don't mind riding with someone else, especially after a while they all get to know each other. And I think it's a little quicker. Well, it's a lot quicker than a flex route. But it'll get you there where you need to go without doing the big loop, riding it for the big loop. And there are people who love doing that, gets them out of the house. There are people who know, I just really want to go. And because I see a beautiful dog laying on the floor, we do accept service animals on our vehicles as well. That's never a problem. Yes.
One of the things we talked about at an earlier meeting was that there's scheduling software for this kind of on-demand service that could be used to not only run the public transportation, but to leverage other existing services, so everyone could be scheduling through that main system. And is that something that you?
We actually have a
work with?
scheduling software that we
Yeah.
utilize. It's called Route Match.
Mm-hmm.
One of the things our dispatchers do, and part of the mobility management portion within the agency that we do, is if we have a call from a passenger and we're not able to provide that trip, we have a great resource that was produced, let me see, through the RCCs. I can't remember when. It's going to be updated. But it is a transit resource guide. We have contacts in all the other providers. we'll reach out to them to see if they could do this trip, if we're unable to.
So what had been shared with us though was actually being able to schedule everybody through that one software, rather than just reaching out
So
to
you're
them.
talking about a one-call, one-click center.
Correct.
And we actually have a model like that over on the seacoast
Mhm.
with Coast and TripLink. Like that over on the seacoast
Mhm.
with Coast and TripLink. It's actually called TripLink.
Yeah.
And that is an option.
'Cause I think that'd be great.
Yep, that could be an option later down the road.
Mhm.
Because one of the things that you want to do is you want to start small and go big. You
Mhm.
don't want to go big and then
And have to
come back.
downsize, yeah.
And, you know, those are all things that you can talk about once you get the service up and running and
Mhm.
see how it's going, and then say, okay, well, this is going well, this was kind of a hiccup, this is some of the things that we would put on our wish list going
Right.
forward.
Well, the reason I ask the question though is if you're gonna invest in an infrastructure like a scheduling software, you want to, if that's your goal at the end, is to pick something that's gonna be scalable in that way.
Yep, so all of the rural agencies are looking at software upgrades. So very soon in the future,
Mhm.
they will be, they will be able to provide better software options.
Yeah.
They're in the works right now, and who knows what that will look like. Hopefully, they'll have software that, you know, the students will be able to say, oh, look, the bus is right here,
Mhm.
and,
Mhm.
you know, it's only gonna take me 5 minutes to get to Market Basket, and
Yeah.
so that's,
It's that dream.
Yes.
You know, that we go.
and the dream's almost a
We're getting
reality.
there, we're getting there. But yeah, realistically, that, in a perfect world, that would be great, to have it done that way. It's certainly a more efficient way to operate, you know, by having those connections. But most of us right now do have a scheduling software, it just doesn't tie in with anybody else's.
Mhm.
You know, it's just our trips being scheduled and performed during the day. But, yeah, pretty much everybody is looking for new software right now.
Yep.
So that that can be an add-on down the road, because once we do that, transportation just got a lot easier, especially to schedule trips. Yeah. Yeah. Any
And I'll-
other questions?
Well, I'll just add, yeah, so in the specifications for that sort of next generation of software, that's very much the forefront of the design needs is to accommodate multi-agency coordination, basically.
Great.
Yeah. Yeah.
Are there plans for this to go to the surrounding towns, like Hampton, Thornton, Ashland?
Yep, we've
Name.
definitely been talking about that, and that would be something that we could discuss in the future. Right now, I think our scope has to be transportation in Plymouth and see how that goes, and again, look at, okay, what's working, what's not working, what stops are we forgetting? This is a stop and it's not, you know, we're not picking anybody up, so it's going to be, a learning experience for sure. And that's what's gonna be really nice about starting small, and then, you know, cause we're gonna hear right off the bat, well, why aren't you coming here, why aren't you stopping there? And it's only gonna be a handful of people saying, well, you should stop here, and you should stop there, but that's the job of, the transit agency, is to say, okay, there's gonna be community meetings, there's going to be outreach, this isn't gonna be, you know, the Brenda and Janine and Bill show.
Yeah.
Oh.
There's gonna be a lot of outreach, and that's where, you know, Nicole and I come into play. You know, there's gonna be days that Brenda and Janine may not be able to make the meetings, and we'll step in and, you know, ask the community, what would you like to see in transportation? And then we'll take all that feedback, and then we'll have meetings with partners and stakeholders and say, this is what your community wants. Now, you know, where
I
we
mean,
go
you
with
know
operations.
the area better,
Yep,
you know, than anybody else.
exactly.
You're from the area, so
And this is
we
old.
need that input, yeah.
This is old.
Yeah. But that tells us, okay, you want stops here, you want stops there, you want stops here. And when we designed one that went in between Lancaster and Littleton, we had about 45 suggestions, stops. And we have to whittle it down because then we never get it. But we're gonna rely on the community and their voices and their wants and needs. Because again, I don't live here, so where does everybody wanna go? What's gonna be the most convenient area that's safe for not only the passenger but the bus to be able to pull over. So there's gonna be a lot of questions asked. Yep.
A way to extend reach, of course this is dependent upon demand, is adding bike racks to some buses. Obviously not year-round.
We have bike racks.
Oh, you do?
Yes, they come,
That's
they come.
terrific.
Yeah, they come standard now
That's
with
terrific.
bike racks. Yeah,
Excellent.
they're really big in the summer and the fall.
Yeah.
And so, oh yeah, they're great to have.
Yeah, just a couple of comments, thoughts. If we're, there's a thought of two vehicles being, probably where you want to start, is there, to try a little bit of both, thinking about flex route and a demand response, one that's on sort of each type, see which one is more popular. And I think they also serve sort of such different populations.
Yes,
The student
yes.
wanting a demand or an instant sort of response
Sure.
versus someone who might be, maybe they have a lot of, a larger neighborhood of, affordable housing and especially age-restricted housing as well on
Yep.
the fairgrounds road. So, places where it might make sense to have, folks who know every hour on the hour, there's gonna be
Sure.
a bus in front of their, apartment building or in front of their neighborhood. And wanna say, get downtown we do have a lot of, each individual employer downtown on Main Street is pretty small, but altogether it's quite a number of employees.
Yes.
And a lot of folks who do make a pretty treacherous walk from Fairgrounds Road, across down the train tracks, or other ways to go to Tenny Mountain Highway, or Main Street, or
Yeah.
even Spear to get
Yeah.
to work. So having maybe a system where they know that every hour there's going to be a bus in front of their neighborhood,
Sure.
and also, a different, for that other need, a sort of demand response for those who are immediate, going to an appointment. I wonder if there's a way to sort of try and both.
We operate that now.
Yep, absolutely.
Yeah, we have flex route, but we also have demand response buses in all of our service areas. No, excuse me, except for Carroll County, we don't do a flex route there anymore. But you are right, it satisfies the needs of different people who, I need it right now, I need to get there, I have an appointment, so flex route wouldn't work for them. But yes, complementing with a flex route like that, yeah, sky's the limit as far as ideas. We just have to make them all come together, and that's part of this process.
And then
Yes.
we also, oops, I'm sorry, we also want to continue working with Transport Central, with their volunteer driver program, also with their on-demand service. We want to be able to, if they want to increase their service, maybe they continue with the on-demand service, and then, maybe we do the flex route. So I'm trying to pull up the map, but in the feasibility study, they did have, kind of like, this would be, kind of a justifiable route. And it's just basically you go out one way and you come back, instead of doing the loops. Sometimes the loops are more time consuming, but this is 2010, so we may have to take a look at that and when it comes
Construction
time.
may have changed.
Yep, when
How we
it comes
can do
time
it.
to the routes and so on and so forth, so, yes.
Yes, I'm thinking about how to get people who maybe don't have a car or, can't afford a car, to get them to some well-paying jobs that could be in the mill yard or in Concord. And this could be what takes them from their house to the bus that goes, back and forth to Concord and Manchester each day. But is there any kind of plan to?
Oh, yes, we have extravagant plans. When does that happen is kind of what we've been talking about now. So there will be a bus going from Concord to Laconia. So how cool would it be if there was a bus going from Plymouth to Laconia that met the bus that goes to Concord, and then that bus
That'd be
goes
cool.
to Manchester, or another bus goes to Manchester. We could get people all over. So, yes, we have been talking about, what's the future gonna bring? So-
Representative, you're shaking your head no. You don't think that's gonna happen?
To get to Concord, I don't want to go to Laconia first.
Oh, I understand. Straight through? Well,
Yeah.
Well, Tilton, if you could stop in Tilton, right off
the
the.
sky's the limit. I mean,
I don't know.
you never know what the future could bring. Yes.
You had mentioned possibly getting Transport Central to do some of the demand response. So my question for Fred is, how does this fit in with our charter because we're supposed to do 60 and over and disabled, not random people.
There are
I-
many nonprofit organizations that take pretty much demand response as well, not
Right,
just
but-
EMT.
But your funding source
Our
is
funding source, which
5310.
is Fred.
Yes, yeah, yeah.
Fred? Where's Fred?
Is this where Fred steps up and talks about the process?
So a big part of it there, again, you're looking at whatever service design, it looks pretty straightforward, right? You buy a bus, you start driving it, and hopefully people show up. But it is those sort of nuances of funding. Again, there's federal, state, and local, but there are different federal requirements, right? Our primary, what we're talking about for this service is going to be, it's called the FTA Section 5311 program, and that is just general rural public transportation. And that can be designed, it's almost like a square and a rectangle, where 5311 is the broader, anybody who you want, as long as it's open to the public. It can be open to a certain segment of the public, and that is if it's designed primarily for seniors and individuals with disabilities, then we can still fund it with 5311. You're funded through 5310. Your service, if you are primarily designed to deploy your vehicles for them, there is, and it's subjective, but there is provisions for others to utilize your service as long as you can demonstrate that it's designed to accommodate seniors and individuals with disabilities. That's it. On the federal side, anything we're talking about today, probably going to be 5311, so it's broader. That's a good thing. On the local match side of thing, there are instances where federal funding, so you mentioned what sound like workforce transportation through Health and Human Services. There are funds for workforce development that we're working through the statewide coordinating council to make partners. I think of Gene,
Yeah.
a gentleman at Health and Human Services that runs the workforce program. It's not specific for transportation, but we're finding out that transportation is a universal issue for all these things, and we're working to maybe peel some of the funds off for transportation to use as a local match for just this sort of thing. So that's what mobility management is about, is trying to get all these pieces together and make a patchwork quilt where it can happen. So did I actually answer your question about?
Fred, could I add a little bit onto that? With the thought of that opening more ridership, Transport Central is a full volunteer driver agency.
Right.
And volunteers are extremely hard to find now. It's hard enough for businesses that pay to find an employment, or people that want to be employed. Is there any way of funding coming up so that an on-demand transportation system could have hired drivers opposed to a whole 100% volunteer-based drivership? To keep up with the demand of helping people that aren't 60 and older or have a disability.
Yeah, absolutely. I mean, that is, ideally, this service we're talking about today will be designed with hired drivers on demand response service that will alleviate the burden of you having to constantly recruit volunteers because there's nothing at all. So if there is, a big part of it would be going back and working with Transport Central, and I think we and they already have been, to figure out where people have been going, for the volunteers. Where are your trips going to and from? And that will be part of the service design to take the load off the volunteers and say, okay, now we're going to have a standing system that can provide those services and a guaranteed with a paid driver and budgeted system as opposed to relying on volunteers, and there's a better chance that they might not get.
One of the speed bump is we have 19 towns on Transport Central, so.
Right, yeah, and this is,
Yeah.
so this, the other 18 towns, for the time being, it probably won't affect those other municipalities so much. But that, again, this is getting the foot in the door, starting small. And on the subject of starting small, again, we have, whether it's demand response or if there's enough consensus from all stakeholders locally that say, no, we're all confident, we're rowing in the same direction, that whatever it is, this is the sort of fixed, we call that a fixed route service, whether it's a loop or just straight line. And if you run a straight line service, the federal funding means that you need to have complementary paratransit. So you can never just have one bus, you have to have a second, basically a demand response service within 3/4 of a mile of either side of the line, either side of the road as well. So it's not just a matter of, oh, how much does it cost to run a bus up and down? It's being able to have the dispatching capabilities to accommodate anybody who can't access the fixed route service. So there's nuances like that that have to be figured into the equation as well. But getting back to your point, it is, if Transport Central wanted to, if it didn't have the capacity to expand at all, that is absolutely understandable. So this is hopefully going to take the burden off of the volunteer-only transportation that we provide.
Right, and the on-demand route sounds like a great idea, you know, for the Plymouth area. Like somebody mentioned about Fairgrounds Road, when the feasibility study was done there, obviously it was done, what do you say, 2010,
Right.
things have changed on Fairgrounds Road and other places, so. but that
And,
does sound
and that's where the community is gonna come into play, and all the partners and stakeholders, you know, that feedback, when we're starting these conversations, that's what's gonna be key to making a successful, route and successful stops.
With the on-demand routes, how much notice do you need for scheduling typically? Like, that's something we run into, we're at mid-state, so patients needing to be seen the same day, can't necessarily get a ride the same day. How does that get handled?
So that works. I can tell you that most agencies require at least 48 hours notice, sometimes even longer. But even the service that I came from, if somebody called that day, we did everything in our power to make it happen. So it'll be up to the agency, whether it's Tri-County, Transport Central, you know, and then if for some reason they can't do it, that's what the mobility manager network is for. So, you know, they would just send a referral to the mobility manager and say, look, this person needs to get from point A to point B tomorrow, and then we do everything in our power to find the transportation option if it's
I have to
Do
say,
we have access to that now?
Yes, yep, we're working now, yep. So if you have needs like that, you know, reach out to Nicole, and, but I would start with like Transport Central, and, you know, you already have transportation, but absolutely reach out to Nicole, and we'll see, you know, if there's a driving company in the area or someone that could do that. The other thing, it comes down to funding, right? So if the person doesn't have insurance, or if they don't have the money for the trip, then it's like, well, we can provide transportation, but we don't have the money, and that kind of opens up, you know, another conversation.
I might be starting that conversation, or maybe it
Yep.
shouldn't be brought up, but does any of this taken place of Medicaid having CTS and being a vendor of Medicaid, does this play in the game there at all with any of this transportation, the Medicaid piece?
Yep,
And maybe that
so,
would be for Fred, I don't.
yeah, so CTS is probably gonna be our Medicaid broker for as long as I'm working, so, you know, they're a great partner. We're working with them now with some of our provider issues. They've been at the table at every meeting with the hospital association, so we're hoping that if there are any kind of glitches, that, you know, they'll be willing to fix them. And, but yeah, if you have somebody that's eligible for Medicaid, that should be the first phone call is to CTS.
Yep.
Right.
They're- Yeah.
Can I bring up one thing with CTS? Not trying to steal the whole program here, but healthy families, I've heard of a lot of, from a lot of people that they don't go through CTS, they go through MTM, a contractor out of California.
Yep.
And there's a lot of people, including cancer patients, that get left at the end of their driveway and don't get their treatments because of the company that Healthy Families has gone with, which again is MTM. And if that could be discussed somewhere, that is extremely important and very frustrating for the people that need those vital trips for their life and just to go to a medical appointment.
Absolutely.
Transport Central has declined to participate with MTM because they're such a loathsome company.
And Tri-County CAP does not work with MTM. We work pretty much CTS, and we've had a great relationship with CTS. But I know when Healthy Families was taken over by MTM, was a waterfall. Problems started, you know, left and right, people being left or never assigned somebody for a trip. That is something that we've been discussing more on the state level, is the brokerage system for the state of New Hampshire when it comes to Medicaid. You have one that does a phenomenal job, and you have another one, not so much.
I want to echo that gentleman's comment. I had I'm up in Lancaster, Littleton area. Had an extensive conversation with someone in Lisbon, and there are a lot of horror stories. I don't know if it was MTM specifically, but it was whoever manages the Healthy Families
That's
program.
MTM.
Yeah.
Yep, we'll start working on that.
We have the same experience too, in case you need more.
Okay.
We're all just going to pile on.
Yeah.
More fuel for the fire.
And the other amazing thing too is we have a great relationship with Department of Health and Human Services. So all of your comments, I can bring to Wendy Altman. She's the one that's been helping us with our Medicaid providers, or brokers, whatever you wanna call them. So all this information is amazing, and when I get back to my office, I'll be emailing Wendy and saying we've got some opportunities we need to address.
Could I just mention the fact that, so Tom Morris is our driver coordinator, and we have a requirement for 3 to 5 days advance notice. But if there's a discharge and there's an hour notice, Tom calls me.
And I will say, we operate the same way.
Yeah.
We don't like to turn anybody down.
Yeah.
So if it is somebody, a discharge or somebody, I've got to get to this appointment, we'll pretty much do everything we can to get them there. It's not very often we say no. We make it work.
Which is kudos to the volunteers,
Absolutely.
because they're volunteering for a very, well, for a fairly low reimbursement
Yeah.
rate. And again, going back to the fixed, not fixed route, but the door-to-door route,
Yeah.
or how you
Yep.
mentioned it, that could be an option for a situation like that in Plymouth, where somebody gets discharged from Spear and needs to
Yep.
go home to Fairgrounds Road or
Yep.
something like that.
Yep.
But I want to give the volunteers, which I have Bill there and
My sister Sean.
the sister next to you are volunteers,
His
so
whole
just
family are volunteers.
giving the thumbs up to them, because without them, we wouldn't
Absolutely.
be, Transport Central would not be, and without Patsy and Doug, we wouldn't.
Yeah.
And that's all of our volunteer driver programs in the state. They're the ones that go out to the very rural areas and pick folks up and bring them to dialysis, bring them to grocery shopping, bring them to the senior centers. So, yes, can't give kudos enough to our programs, yes.
I'm curious, so we've been talking about lead time for volunteer driver programs, but if we were to implement part of a public transportation on-demand program, would it still be a 48-hour advance notice? Because
Most of
if
them-
I were a user, I would find that not very convenient.
Yeah, so most of them, due to the software, require at least 24 hours. But there again, the agency that I came from, if you called me in the morning and you wanted to use the on-demand service, if it was available and it was going that way, I could put you on right away.
Okay.
If you called for an afternoon trip, I could do the same thing. That's definitely something that we could look at here. It would all depend on, again, how many buses, how many drivers, and how full the
Yeah.
and how full the schedule is.
Because the criteria we saw at the beginning were people wanted something quick
Yeah.
and people wanted something that was on demand, and 24 to 48 hours is not really
Right.
quick.
Right.
I mean, there's, Uber is awesome,
Yeah,
taxis are great, Lyft is okay, but public transportation in and of itself, it's its own little bird. So to call it on demand doesn't, it's a
Quite
little
capture
deceiving
it,
because
yeah.
it's not gonna be there in 5 minutes.
mhm,
You know, if you're working with a system like what Terry used to have when she was the director, or what Janine is currently operating, it doesn't mean we can't do it, it means we can't do it in 10 minutes, can you give us
Right.
20? That we can do, because we're actually going right by your house.
mhm.
That's part of the whole dispatching thing, is the dispatchers will sit there and look at where the buses are, what the schedule is, and go, well, I can't do 10 minutes, can you give me 20? And they'll negotiate a pickup time. But normally 24 hours in advance, most people can say, yeah, because I'm just going to the grocery store, that's fine. But most of us do everything we can to do the last minute request as well. Because stuff happens and you gotta get there.
And there is a model that we can put on the wish list. There's a service called Microtransit, and over in the state of Vermont, they've had some great success with Microtransit, and it's definitely that on-demand service. But even with the Microtransit, if you put into your app that I want to be picked up at such and such a time, there's still no guarantee that you'll be picked up at that time,
Right.
because that vehicle still has to go from here to get you, and then, you know, depending on how many other people wanted to be picked up at that time. So there's nothing right now besides Uber, and even Uber, I mean, if you called an Uber driver, it's gonna take them 10 minutes to get from, you
Well,
know,
we don't have
point A
to.
to
We don't have.
We don't have that here.
Yeah.
If we had that, that would be a
We
great
have one
solution.
taxi cab lady that,
Yeah,
Mr.
is
C.
near retirement.
Okay.
but that's something, like I said, we could put on the wish list for the future, and that might help the outer towns, bringing them into Plymouth. Or microtransit could be something we could look at, in the winter months, bringing people to Waterville Valley, Blue Mountain, those type of areas.
And I think that, sort of going on to that point about the kind of people are kind of afraid to use, even if they, you know, in general, it can be accommodated, but people are afraid of, oh, it will be 48 hours. I'm not gonna try to use it. I'll need to find another way to get there, you know. I think that speaks to kind of the power of that flexible fixed route that you were talking about as a complement, because if they know, you know, I'm too, either I may not have a cell phone, I may not have a smartphone, but I'm here, you know, just got out of my appointment and I, you know, can't, that may not be a great example, but someone who knows that, well, the bus is gonna stop, you know, right there, 25 minutes past the hour, and then it'll go close enough to my house that they can flex the route and drop me off.
Yeah.
I think that's kind of the power of having that as well, is that people who may be a little bit less comfortable with using either the technology to call a service like that, may not have the, you know, the ability to call, or may have something, you know, that comes up on more short notice, but still, you know, want to get there via public transit, or, you know, may be aware that these options are out there, but are, you know, so they're nervous about that, the perception of that lead time, even if in the reality that lead time may not really be a factor. They say, oh, you know, this is gonna take 24 hours, I can't do it. I think the perception is as big as, even probably more so than the reality of what those are, is the perception from the user end. So that's why having, I think, a balance of both is really powerful for both the perception of the user and also for folks who may have not have access to the technology to call or request something on a demand basis.
Exactly, and, it's gonna be up to us, Nicole, myself, and some other partners, to get the message out there that, yes, this is the policy, that we ask that you call 24 to 48 hours in advance, But if we do, if we are lucky enough to have that on-demand service, you could call, you know, within a couple of hours. And trust me, there's gonna be some of those riders that know, well, I knew 6 days ago that I had this appointment, but I'm gonna call that morning and say, I gotta go.
Always. There hasn't been a call or a request that we haven't dealt with. It's either Terry's system, our system, we're kind of used to all of it. That's why we work hard travel training some of our passengers, which means there is a person who will travel with that rider to show them how it works. And quite often, it's our more elderly population who gets very nervous. That, you know, they don't know the driver and, you know, are you going too fast? And, you know, it's different than being in the car. And are you really gonna come back and get me? Because that's one of the biggest fears. You're gonna forget me and I'm gonna be stranded and I can't walk home. I don't have a cell phone, I don't know what to do. So travel training is something that we do with our passengers who are new to transportation. I would expect travel training in this area as well.
Yes.
It's not just a meeting, it's physically getting on board with them and showing them how it works. And you're very correct, not everybody has the modern technology.
Yep.
Because I come from rural, you come from rural, we're used to people not even having cell phones.
Even the big
Yeah.
cities with the best technology, you can still call their office and book a ride. It's just how it is these days. And when this service does kick off, you know, we're gonna be looking at our partners and saying, okay, you know, we're gonna set up the bus at the senior center today, and we're gonna just invite everybody to come and take a ride, and we'll take a ride down the routes. And, you know, there's gonna be a lot of press releases, but there's gonna be a lot of media around it when it does start. There's gonna be a lot of, you know, I wanna say kind of like the touch a truck type of thing, come see the bus, come meet the staff. You know, there's gonna be a lot of that. Travel training, Nicole will be doing travel training, Tri-County Transit, Transport Central, everybody will be a part of it, so. You know, we're not just gonna start the service and say, go ahead, just jump on and see where you end up.
Good luck. Yeah. No, it's a community, bringing a community service.
Yeah.
And that's how we look at starting new services. It's the communities involved that make it successful, because it's their ideas, it's where they think it's best to go, and it's about training each other how to use it. So it's not like, the bus just doesn't show up and drives around all day with nobody on it. There's a lot of work beforehand, and a lot of meetings, and like Terry said, the touch a truck type events gives people the opportunity to actually get on and ride it.
And ask questions
Yeah.
and make it better. We can't make it better if we don't get feedback, so.
Yeah.
You know, we have the university, you know, hopefully we'll be able to get some students involved, and, you know, maybe they'll be able to be a volunteer that will take folks around. And it's not like once the service starts, we're gonna be like, all right, we got it going, that's it, we're done, next town. You know, we're gonna keep following up, because we want it to continue to grow, and see it succeed, and get those rural towns outside of Plymouth into Plymouth. So, yeah. Any other questions?
What will the cost be to the passengers, if any? Is
We
it free?
could, I mean, that's definitely a conversation that we'll have to have when we start the planning. You know, of course, we would love for it to be fare-free. The system that I came from, it was fare-free for older adults and folks with disabilities, and then it was very minimal. I think it was like $1.50 in town, and then if they went town to town, it was $2.50. So it's not gonna cost a lot. There's programs out there, you know, like folks that are eligible for Medicaid, we might be able to get them some bus passes. You know, there's definitely some programs that we can take a look at when we start, and it all comes down to funding, right? The more funding that we get, the less it's gonna cost the passengers. So that's definitely something that we'll have to discuss when Bill gets his bus.
It's about $5 a trip, but that's okay. We'll discuss it.
Bill? Bill?
Yes.
Can I Hi, Fran Taylor from Holderness. I want to just tell a little story about why I've been talking to Bill for quite a while about a bus. Is I was out registering voters out at the Unitarian Church Housing Development and met a very nice man out there who has 3 children and no transportation, none. He has no functioning automobile. And I was just struck by that because I realized that it wasn't just for him that he needed the transportation, but the kids, they can't get here. How would they get to the library? How would they get to the town hall if they needed to get a permit for something? And I was just so, it really bothered me, and it continues to bother me, that there might be other people out, particularly on Fairgrounds Road, with no transportation, and it really is too far to walk. Please, let's not have anybody trying to say they should all walk to Hannaford, buy their groceries, and then come back with armloads of groceries. It just isn't going to happen. Of course, he, by the way, a dad, relies on neighbors to help him out, which they do, but that doesn't always work. So just to mention that that's how I got started on my interest about this.
Thank you very much.
Thanks, Fran. In fact, I've used your story. Your
Yes.
story been kind of in the back of my mind,
Bill
since
has
you told
told
me.
me.
And we did bring up Fairgrounds Road a couple of times at this meeting, so we're aware of that need. So yeah, it's something to focus on.
So Fred, if Transport Central gave him a ride to the grocery store and back, can we get funded for it, reimbursed for it? Our princely rate of 3.5 cents a month?
If you deploy it specifically for a gentleman who's not a senior or individual with disability, I don't believe so. But the town of Plymouth, I don't know what other resources there are, but every town, it's RSA 165 right there. If the town has somebody on their roll, it's essentially, it's called welfare, right? The town is, that's definitely a core welfare issue, right? The person needs to go get groceries and has kids. Working with the town so that you can bill it to the town instead of that program, or when the service comes up, demand response model, it is a matter of just the software has provisions to bill it to these different federal programs that the person is eligible for. But you currently, right now, through your 5310 funding, I would say, no.
We do provide rides under certain circumstances and just eat and pay the drivers and don't do anything.
Yeah, yeah. I mean, and that's what we're trying to sort of get away from. But yeah, I would say it's a great question. I will. So the safe answer today is no. I'm going to bring that back and actually run that by FTA to make sure, because they. This is one of those things that they preach coordination, but when it comes down to it, all these silos still exist in those sort of services. But if we just say, well, clearly it's designed, right? We can go to your website, it's designed for that, but somebody else has this other need. So I can see that opening a floodgate for the feds that they don't want to have open, right? Because that's what. Yeah.
Maybe one fewer.
Exactly. It's right. You're not. In my mind, as long as you are not, Transport Central isn't out there saying, hey, anybody who's welcome, we're going to get paid for it through this program, but it's clearly designed for a specific population, and somebody else happens to call. They have a sort of a vetted reason.
We can just define him as disabled.
In the meantime, we go after our selectmen in different towns, right?
So, and you're representative too, but, and actually.
Spiraling out of control in a hurry.
So I'm a select board member in Plymouth, and we also have our welfare director sitting in the front row right here, so We got
Yeah,
plenty of
and that's
money.
where, so,
I don't want to just receive a bill, I mean, there's a process. that
yeah, exactly,
the
so
person
that's,
had to go through before,
Right.
you know, I could,
That's true.
authorize transportation. I mean, if I received the bill from Transport Central, didn't know anything about it.
I didn't mean to suggest that, that's how it came through, but, yeah, I mean, that's,
But
so.
your select board member is me, so you think twice about that.
Bill's like, yeah, bus is coming.
And, I mean, please fact check me, right, I happen to remember that.
Oh, and I'm sorry, I wasn't
RSA,
listening,
but-
it was before.
So, in that sort of instance, like every town is different how they, well, how they manage their own system. But yeah, if this gentleman sort of went through the vetting process,
Oh, sure,
it
if
was on
somebody
rolls and
needed
it's,
transportation, you know, we would see where they're at, and it all depends upon what's going on.
yeah.
We would get them there. We normally, if it's Medicaid, we recommend Transport Central.
But I might have a temporary solution for you. We can talk offline after this meeting
Okay.
with Brenda. So I think we're at the point where we can start talking about next steps. Where do we go from here? We know what we want to do. We know that the need is here. So where do we go from today? And so I think it basically comes down to Mr. Butler to kind of give us next steps of this is what we can do from here going forward after he makes a note on checking these hours.
It's almost a chicken and egg scenario. Again, it's been in, well, there's a feasibility study showing it's feasible back in 2010. 2018, it resurfaced as a tier 3 priority. Since 2018, it's changed. The federal funding is projected to be there. We have 2-year solicitations for this rural public transportation programs, FTA section 5310. So that cycle has just started. So it'll be another year from now, so I'll say not this coming winter, but the following winter is when we have a solicitation for the next biennium cycle. That's probably most reasonably when this would start. There's an outside chance we'd have some sort of off-cycle expansion grant solicitation at DOT and for this sort of thing. But the reality is, within the next month, we're going to have, it's a capital solicitation for the buses, because there's such a long lead time. I would say getting the buses ordered in advance is the priority, and that is hypothetically, right? And that is potentially, it's potentially jumping the gun. But the worst case scenario is by the time the buses came, if it all fell apart, chances are there will be other transportation providers that would gladly take those buses when they came in.
I know one.
So yeah, and so in the next month here, the next step is getting support in the local match needed for those buses. The buses, currently there's no statewide contract in place. So buses that 5 years ago cost, I'll say $80,000 are now upwards of closer to, I'll throw it $130,000.
Wow.
And that, yeah, I mean, it's ridiculous. It's, blows my mind. The good news is, on those vehicles, it's 85% because they are ADA accessible, 85% federal. The state will pick up 7.5%, so local match is 7.5%. So that works. That's about $10,000 a bus. Would it's not as simple as one bus. You'd probably be looking at probably 3 to be safe. Two to start, maybe if.
Transit being thrown in.
And you'd also have to factor in maintenance
Yeah, that all comes with the 5311 contract.
Okay.
That's something that,
And
yeah.
to backtrack too, we realized, so Tri-County Cap doesn't operate in Plymouth right now. They operate up in Berlin, Littleton, Lancaster, Carroll County. So this would be essentially an expansion for them. But just so everybody's aware, the reason why it makes sense for Tri-County Cap to do that is because the amount of federal red tape involved with compliance with federal regulations. So Tri-County Cap has the management system in place, they have the software system in place. It's just a matter of buses, drivers, and they do not have their own local match. So the town of Plymouth, surrounding areas, but primarily Plymouth, it would be a matter of getting sustainable local match in place, and that's across the state. Again, that's the limiting factor everywhere. So if they, in addition to letters of support, there's actual support, that's going to be the key ingredient to making this happen. Any other questions about next steps?
Do we have that local match already? Like, is somebody,
Well, it depends, I mean, I guess we indicated like a $250,000 local match, or what? Or
And-
not necessarily, not the bus, but just the match.
No, and even that would be, so step one, we don't pay the vendors until the vehicle is delivered, but we need a guarantee, somebody's gonna be on the hook for that, and nominally it's gonna be Tri-County Cap that's on the hook. So if they get burned by doing this, then they'll just have that much less match available when the time comes to actually operate the service. So to ramp up, and we're talking about the next biennium, which would start probably July 1st, 2025, would be the actual start of that next biennium period.
Yeah.
So that's when the actual bills will start coming due for operating. That $250,000, that was a total overall cost for operations. And again, that is that particular 2018 study, which starting off the response, that it's a more simplified, but basically for every dollar of service, the feds will pay 50 cents of operating, so 50%. I would say if you use that $250,000 budget to do whatever you can, that would mean, worst case scenario was $125,000, but there's actually sort of sub-operating that we can take advantage of. Like capital preventive maintenance is considered a capital expense. It's not actually operating, like paying for gasoline, drivers. So that is actually 80% federally funded. So it's, overall, it usually comes closer to 2/3 is federal money and 1/3 is local. So if we want to round that up to a $300,000 nominal budget, $100,000 each year would have to keep coming in to keep that going.
And the cost is variable at this point because depending what type of service is decided upon is going to affect the cost to operate the service. You know, if you're running a flexed route and door-to-door vehicles all at the same time, then obviously, you know, you build the route, and once you figure it out, then you figure out the operating costs to do that route. And that includes not just drivers, I understand it, driver salaries and stuff like that, but it also includes the maintenance costs, the vehicle fuel, the insurance on it. All of that stuff gets factored into the budget for the year just to operate the system. We have $1 million budgets for transportation and some of the other programs we provide, but it's all based on what is the final service we're going to provide. And that'll tell us this is the cost, this is what you need to figure on for match. Our agency, when we get match, we go to the towns to help support the programs that we're providing. Local matches is a really big deal. That's how we get our federal monies and state dollars, is we have to have the match for it. And operating costs are only reimbursed 50%. And unfortunately, that's the most expensive part of a project or a transportation system.
And I mean, the agencies think outside the box as well. I mean, you think about it, you're gonna get a big white bus. I mean, Plymouth PSU buses come usually as a big white bus. So there's advertising opportunities. You know, and that brings in some of the match. And then there's stakeholders in, you know, kind of each and every town. So it's not that the agencies look at the municipalities and say, well, if you want public transit, you have to pay up. That's not the case at all. You know, and that's part of my role as well, is, you know, looking at the stakeholders, who is willing to, you know, pay it forward to the community and help with the match money for public transportation. So, you know, I don't want everybody to think, well, okay, our taxes are gonna go up because we have public transportation. That's not the case at all. We look at all of the partners and all of the stakeholders.
Including the medical centers we
Yep.
stop at, the hospitals we go to.
Yeah.
You know, we do fundraising as well. All of that is considered our match monies. Yes, I know, she's a killer at fundraising. She comes up with a lot of money. But we use all of that as the match for the operations. We also use all that as match as well when we're purchasing buses. 130,000 for an 8-passenger. Seriously, that's crazy. That's 10,
It could be
okay.
129.
Wow. Maybe 5. But it's not just up to the towns. It's up to all of us to get that buy-in from our community, whether that's business owners or churches, hospitals. You know, we get a lot of sponsorships for those ads on the side of the bus. We make money off of that. There we go, local match.
How soon would you see a warrant on it?
Well, so if we're waiting to 2025, you know.
24.
Yeah, so is there any point or desire to do like a pilot or, you know, with a borrowed bus or something, or?
It's definitely something we can discuss. That would probably be a smaller group of stakeholders to have that discussion to see, you know, how we would move forward with that. And of course, DOT would be the key player in that one. But yeah, that's a possibility if you could, you know, find a used bus. Good luck, Janine's been looking far and wide.
I've got 2.
So, I mean, we can keep looking. I can tell you that throughout the state, the mobility managers have been doing a great job with looking at buses that sit idle, like at community centers, YMCA's, to see if that's an option.
You just sneak in at night, or?
No, I mean, if that partner is willing to use that bus, but we just have to make sure that if there's any FTA money that's going into this service, that we follow all of the guidelines provided by FTA and New Hampshire DOT, so.
Would DOT be sympathetic, or do you see that as desirable, or just like, we should just wait?
No, that is, it may be, I don't know of any buses that are sitting out there, just, again, because they're nationwide shortage, you know, you have the auto workers strike on top of that, and it's, just, you know, we've been scouring for vehicles, and the used market is very high too, but to Terry's point, right, yeah, there might be somebody around who said, yeah, no, we only use ours, said once or twice a week, and we can get this started, and,
Or a college bus out of college season might be slower and they might be willing, right? Possibly.
Well, unfortunately, just left, just retired. So we've had a conversation with President Burks as far as like utilization of university buses, and he seemed very receptive at the time. We haven't really kind of nailed that activity down, so I'm not certain, you know, that may be a useful, you know, tool. I don't know if we can end up using them, but that would be very desirable. I don't know if they're FTA, probably not.
So generally not, and that's another nuance of how this all works, right? Like Plymouth State seems like it could be an option if they have their own, let's say, through student fees and whatever else the town can come up with, or whatever stakeholders. If they wanted to start this service, we essentially couldn't put a dime of federal money into it unless they met all those federal requirements. Like their vehicles would have to be accessible. They can't just run the bus up and down. They need that secondary complementary transit bus. So all that stuff, certainly we can talk to them. Where there's a will, there's a way. We can go through all that with them and sort that all out about how it might work, again, through partnerships and that sort of stuff, right? If they're willing to do a bus up front, that would be ideal.
And I spoke to somebody, and may have access to another bus, and I'm not, it's not a done deal, but may have, wheelchair, what's that, lift in the back, yeah.
I don't know if this is something you have, data on, but here's for a somewhat comparable type of service is what we might be looking at. How much of that local match do they, like as a percentage, do they typically recover from user fees, sponsorships, selling, passes or anything like that? Is there any?
So that is another nuance of how the Federal Transit Administration, so I use that, the FTA acronym, but the Federal Transit Administration, user fees have to be deducted when they, so it's not as, there's no way to get enough fares generally. The fares just reduce the amount of federal that's requested, but you still have to come up with that extra 50% match. So that is why the way the current system is, a lot of times going fare-free could make sense when you factor in just the actual fare collection system on the buses, the time to manage it, all the policies that you have to have in place. And, so as a percentage, local agencies, I'll say it's 15% sometimes. They call it fare box recovery, and the other 85% is still all the other funding that's needed. So, and the costs escalate. That 15% sometimes is made up for by getting additional people riding the bus, right? That's the trade-off. People riding the bus and the cost of managing all the fare collection systems and stuff. So it's so advanced transit, they are sort of on the national level, right? I think a lot of people are jealous of how advanced transit is able to operate.
Everybody knows.
They are. So they're fare free through a lot of municipal and the private donors, the colleges, medical facilities and stuff. Over the years, they figured out that partnership allows them to have a complete vibrant system, and people don't have to worry about that. And so it makes up in ridership, but there is a nominal cost to obviously not having fares.
And then just for, kind of like for instance, just roughly how much match money do you need to operate your system? Off the top
Too
of your
much.
head.
Yeah. Well, and so this rural public transportation, in New Hampshire statewide, we have, it's about $5 million worth of contracts statewide, and there's about $3 million in match needed.
Yeah.
And of that, through a coalition last biennium through the state budget cycle, they were able to get what was traditionally $200,000 a year statewide, and that's not just rural. That is also urban. I'm not even talking about urban. But $200,000 statewide is up to 1.8 million. So it's a huge jump, and it's still that. And not even talking about the urban side when we talk about 3 million just on the rural side needed. And that say 500,000 is covered. So it's yeah, I would say it's closer to 20% of what's needed through the state, and that you know, hopefully that's sustainable each biennium, but it's never guaranteed. Step in the right direction, sir.
Any other questions, comments? Yes.
I'm interested in if this program is an enlargement or an improvement over an existing Transport Central, and how do we come up with a word picture for getting the citizens to, you know, a warrant article, if there's any part that the citizens need to stand in support of. I don't know if there's any part that we would need to raise and appropriate our match to a system. How do we connect this to the citizens at large?
Yep, great question. So I think first step there is just getting out to the community. Nicole's got a meeting with, or she's going to be giving a presentation to at the senior center, and just letting folks know this is what you have, this is what we're thinking about, and start getting some of that feedback. There's all different ways that we can engage with the community. We can send out surveys, we can have meetings, and getting feedback from everyone. You know, and then as we get closer to needing that warrant article, that's when this wonderful man is going to come into play. You know, he'll be probably the one to contact as far as, you know, there's different options too. There's some towns that add a little bit to their registration, and that money goes towards transportation. You know, bingo, a couple, you know, every quarter. There's lots of ways to raise match. So we're, that's going to be our first focus as the state stakeholders, is not having that get put back on the citizens. We will do everything in our power, and you know, I can probably speak to every rural agency that they will make it happen so it doesn't go back on the taxpayers. That's why we look at stakeholders and partners in the communities to come forward and do the advertising, and do those type of things, and you know, everybody gives a little bit, and then it doesn't go back on the taxpayer. You know, the municipalities, we understand that they're all struggling. I mean, gosh, this summer put such a strain on you know, the municipalities as well. So, yeah, we do everything in our power so it can go back onto the taxpayers.
So
just to plug in, 53% of our property are owned by nonprofits, and therefore, you know, 46% are carrying a load of taxation in town of Plymouth. So we're very sensitive about adding taxes.
Based on that, is there towns that have had any experience talking with the business community, and specifically to say that they sponsor like advertisement on a van, bus?
Oh, absolutely.
So that we can get something started with our Main Street or Tenny Mountain Highway business community to see how they could fund the START program.
Yeah, absolutely. I mean, that's kind of what Fred was talking about. You know, next step is getting prepared for purchasing the buses, because the contracts will be out on the street in the next month or so. So you have time to start having those conversations within your community and saying, look, we need to come up with $20,000, $30,000 just for match for some buses.
Right.
And then start building that bank account, because you know that, you know, if Bill gets his bus, you're going to need that match money for operations. You're going to have to hire a few drivers. You're going to have to pay for all that preventive maintenance. So starting those conversations now is definitely the way to go. You know, and just Your Chamber of Commerce is gonna be a key player. You know, and then just start talking and coming up with plans for fundraising. You know, is it having a bingo, or is it having casino night? Is it doing this, doing that? It'd be a whole lot of bake sales to get a bus. So, you know, you gotta kind of think bigger picture. Start looking at those smaller organizations, your Moose Club, your VFW, your Elks. You know, every little bit helps, especially in these rural regions. They don't have the, you know, like I said, the municipalities are strapped. So you have to think outside the box. There's some other resources that we can definitely work with Bill and some of the stakeholders in town, as far as like other grants that we could use to match the federal funding. So, yeah, there's a lot of work on our end that we'll have to do as well to make sure that it doesn't get put back on the citizens, because that's the last thing we want. And I don't really think, I don't know if any of the rural agencies have had to go back and do anything on a warrant article for funding. I can't think of any off the top of my head. The area that I came from, the only warrant article we had was just requesting funding going forward from the county, so,
All right, that wraps it up, that's ours.
Yeah, line dance is going to be happening. So if you want to stick around for that, yeah. But I guess this was a very productive first meeting.
yes.
So,
There'll be many more meetings.
yeah.
And like I said, if there's any questions, if anybody has any questions, you know, I can give you my business card. You can reach out to Bill, Brenda, Fred, please.
Transfer Central magnets for your refrigerator.
Transport Central. Yes, so eventually Plymouth will get a bus.
Yep.
Thank you all very, very much
Thank
for
you.
attending.
If anyone hasn't grabbed my brochures or business cards, it's in here too.